Hello, everyone. My name is Juan López, and I am from the group 10C. Today, we will talk about Parkinsonism. Parkinsonism is not a single disease, it's a clinical syndrome characterized mainly by bradykinesia, rigidity, resting tremor, and postural instability. The most common cause of Parkinsonism is Parkinson's disease, but there are several other disorders that can produce similar symptoms. The most understanding the difference between these conditions is essential because prognosis, treatment, and progression are different. What is Parkinsonism? Parkinsonism refers to a group of neurological disorders that affect movement. The core feature is bradykinesia, which means slowness of movement. Patients may also present muscle stiffness, tremor at rest, difficulty of walking, balance problems, and reduced facial expressions. These symptoms occur because of dysfunction of the dopaminergic system in the substantia nigra of the mesencephalus, just right here, in this part of the brain. Parkinson's disease is the most common Parkinsonian disorder. It's a neurodegenerative disorder caused mainly by loss of dopaminergic neurons in the substantia nigra of the mesencephalus. The typical clinical features of this disease are resting tremor, that is tremor at rest. Rest feeling tremor is one of the names, like this. And bradykinesia, that is slowness of movement, rigidity, shuffling gait, and non-motor symptoms. Non-motor symptoms are important. Important are constipation, depression, REM, sleep behavior disorder, and cognitive impairment. Patients usually respond well to levodopa therapy, especially in early stages. Now, let's discuss atypical Parkinsonism. These disorders resemble Parkinson's disease, but usually progress faster and respond poorly to levodopa. The major atypical Parkinsonism are multiple system atrophy, progressive supranuclear palsy, corticobasal degeneration, and dementia with Lewy bodies. Multiple system atrophy combines Parkinson's, autonomic dysfunction, and cerebellar signs. Patients may present orthostatic hypotension, urinary incontinence, erectile dysfunction, and ataxia. Response to levodopa is often limited. MRI may show characteristic findings such as the hot cross bun sign in the pons. Now we will talk about progressive supranuclear palsy. Progressive supranuclear palsy is characterized by early falls, axial rigidity, and vertical gaze palsy, movements of the eye, vertical movements of the eye. Patients often have difficulty looking downward. Speech and swallowing problems are common. A typical clinical clue is a patient who falls backward early in the disease course. Now we will talk about corticobasal degeneration. Corticobasal degeneration is usually asymmetric. The clinical features may include limb rigidity, dystonia, myoclonus, apraxia, and alien limb phenomenon. The alien limb phenomenon occurs when the patient feels that one limb acts independently. Now we talk about dementia with Lewy bodies. Dementia with Lewy bodies combines cognitive decline, visual hallucinations, Parkinsonism, and fluctuation attention. Cognitive symptoms usually appear before or near the onset of motor symptoms. Patients are often very sensitive to antipsychotic medication. Now we have secondary Parkinsonism. Not all Parkinson is neurodegenerative. Secondary causes include antipsychotic drugs, vascular disease, toxins, and normal pressure hydrocephalus. Drug-induced Parkinsonism is especially important because it may improve after discontinuing offending medication. The diagnosis is mainly clinical, with a neurological examination. Imaging studies such as MRI may help in select cases. Important red flags suggesting atypical Parkinsonism include early falls, rapid progression, poor levodopa response, and severe autonomic dysfunction. The treatment depends on the underlying disorder. Levodopa remains the main therapy for Parkinsonism disease, and additionally, measurements include physical therapy, occupational therapy, speech therapy, management of the autonomic symptoms, and cognitive and psychiatric support. In conclusion, Parkinsonism is not just one disease. It is a syndrome with multiple causes. Parkinson's disease is the most common type of Parkinsonism, but atypical and secondary forms are clinically important. Recognizing the characteristic features of each disorder helps improve diagnosis, treatment, and patient care. Thank you for watching.